We are broadcasting live from the Neonatal Intensive Care Unit here at Children's Hospital of Wisconsin. My name is Corey. I work on the social media team, and today we have a very special broadcast for you. We're going to give you an exclusive look at what it's like to care for a baby in our NICU. I'm going to introduce you to a NICU family. You'll learn about their daughter's NICU journey, and I'm going to introduce you to some of the doctors, nurses, and staff that help us care for babies with complex medical and surgical needs. And we would love to hear from you. So if you have questions about our NICU, if you have questions for the family I'm about to introduce you to, I encourage you to please post your questions in the comments section of this video, and we will try to answer as many as we can throughout our live broadcast. And for everybody who's tuning in right now, please click the like button and let us know you're watching. We really appreciate your feedback. With that, I'd love to introduce you now to Molly and Adam. They are the parents of 7-week-old Macy, who was born with 2 life-threatening birth defects. And we're going to hear about their story today. So thank you so much, Molly and Adam, for joining us.
Thank you.
So to begin with, I thought it would be helpful to learn a little bit more about Macy. And before we learn about her NICU experience and her medical condition, can you just tell us a little bit about your daughter? What is she like?
Sure. Well, Macy is definitely a fighter. She's been through more in her 7 weeks of life than most people do in a lifetime. Mm-hmm. I would say up until this week, she was really easygoing. But she's developing a little bit of an attitude and an opinion. So now we say she's a diva, which is great. I think that's a sign that she's feeling much better. Definitely developing a little bit more of a personality.
She lets us know when she likes something or when she doesn't like something.
Yeah.
That's good.
That's great.
Well, let's start from the beginning. Take us back to before Macy was born and just walk us through what your family was like and through your pregnancy with her.
Sure. Adam and I have a 2-year-old daughter that keeps us on our toes. And then we found out that Macy might have some complications when I was about 30 weeks pregnant. I had polyhydramnios, or too much amniotic fluid, which is what my doctor decided, or was basically the reason he decided to send me on for more testing. And the first ultrasound, we found out that she had some kidney abnormalities and potential cardiac abnormalities. So we knew those 3 things: too much amniotic fluid, potential kidney and heart abnormalities, prior to giving birth to her. We had no idea that she was going to have a problem with her esophagus. So we learned that day 1 of life, she was having trouble breathing.
So where are you guys from again?
We're from Appleton.
And where did you give birth?
We gave birth at Theta Clark and Nina.
Okay. And so describe that first day. It sounds like when Macy was born, everybody was a bit surprised. Is that what you say?
Yes.
What was those first few hours, that first day like for you?
You know, quite honestly, she was born via C-section. Yeah. So I was still recovering from my own surgery. So Adam could probably kind of speak more to what it was like.
They brought her to a special area just because there was some breathing issues right away, where her O2 levels would drop way down. They would need to put the mask on her, bring it back, and after a while they gave the NICU at Nina a call, and they said, yeah, we need to bring her down there. Something more was going on. And so it was difficult because Molly was still in the room. She was recovering. She had just had a C-section. So I was there. She was in the room. We weren't sure. Molly didn't know yet. So that was a little bit difficult.
So Macy was transitioned to the Children's Hospital of Wisconsin NICU in Nina, and I think it was that staff in our NICU then that ultimately diagnosed Macy. Is that correct?
That's correct.
And what was she diagnosed with exactly?
They told us that she definitely had esophageal atresia. So basically what they did is they took something and sent it down her esophagus, and it did not go all the way down to her stomach. So basically they knew that there was a gap that wasn't connected to her stomach and the esophagus. So basically there was a separation. As it turns out, she also had an abnormal connection between the trachea and the esophagus, which we didn't know at the time. We just knew that there was a gap in between her esophagus.
Well, joining us on today's discussion is Tiffany Zamzo. She is one of our neonatal nurse practitioners. Tiffany, can you help us understand a little bit more from the medical side of what this diagnosis means for a baby?
Yeah, Macy, after being transferred to the children's NICU up in Neenah, was found, as Molly alluded to have an esophageal atresia. And with that also has a tracheoesophageal fistula. Both of those things are commonly found together. They can lead to feeding difficulties. They can lead to breathing problems, both of which Macy experienced early on. Long term, what that means for Macy is that she has had that connection between her stomach and her upper esophagus fixed, so she does have an esophagus that goes from her mouth all the way down to her stomach now. The connection that was between her trachea and that upper area of her esophagus is now closed, and we follow that closely even after it's been surgically repaired. So with the esophageal atresia, Macy and other babies that have a similar condition require a gastric tube placement for feedings because it's difficult for them to eat by mouth and to eat by mouth comfortably.
So I understand when that diagnosis was made at our Neenah NICU, you guys were then transported down to our Milwaukee NICU where we are today. Is that correct?
That's correct.
Yep. So when you learned you would need to come to Milwaukee for probably an extended NICU stay, and you guys are from Appleton.
Yes.
What's going on in your minds now?
That first week was pretty overwhelming. The days just ran together. We met so many people when we got down here. And the only word I have for it is pretty overwhelming.
Well, to give you an idea too about Molly, she traveled down here less than 24 hours after having a C-section. So she was down here, nothing was stopping her. So
yeah. We weren't so much thinking long term of what it was going to look like being here for an extended period of time. We really were just trying to take one thing at a time and absorb all the medical information we could because this was very new to us. And luckily, the staff here is phenomenal. I mean, the communication is excellent. They round every day on your child, and we felt like we were so informed right from the get-go.
Well, and just the coordination too with Neenah down here, staying at the Ronald McDonald House, which is where we've been staying. It was a worry that we didn't have to have. It was taken care of. We went in there and it was spot on. So that was a worry that we didn't have to have because we had enough enough going on. So.
Yeah.
So those first few days here in our NICU in Milwaukee, what were they like? When did you guys first get a sense of what that treatment plan would be like for Macy?
Really right away, they told us that she would need surgery within the first week of life. We were told that in Neenah already. And then when we got down here, the surgical team wanted to make sure that they knew exactly what was going on with her heart, with her lungs, with everything else, so that there were no surprises when she went in for surgery. But they ended up basically saying she needs the surgery sooner rather than later because she was she's having problems breathing, and she would actually have apneic events where she would basically turn completely blue and wouldn't breathe at all. So then surgery was kind of moved up, and it was done on day 3 of life.
So on Macy's 3rd day of life, she had 2 surgeries to correct these birth defects. Tiffany, can you talk a little bit about what those surgeries are and what they actually do?
So one of the first things that they do is they go in, and that connection between her trachea and her esophagus, they cut off that connection and they do their best to seal it off. The next thing that they do is they take a look at the distance between where her upper esophagus ends and where her stomach is, and how much of the esophagus has developed from the stomach up. Sometimes, as in Macy's case, they're able to kind of connect the two together and bring that upper portion of her esophagus and connect it to the lower portion of her esophagus. Sometimes they're not able to do that. So they kind of suture the 2 parts of the esophagus together, and then we wait about a week, and we have the baby go down to our fluoroscopy department with a speech therapist, and they do what is called a video swallow study. So under continuous x-ray, they have the baby swallow contrast from a bottle, and what they're trying to do is they're trying to make sure that there are no leaks from the two areas of the esophagus that they've connected. In Macy's case, she does have a little bit of a leak. So we've not been giving her full ability to take bottles just yet because we're concerned about fluid going out into her chest cavity, but also she aspirates a little bit of fluid when she eats too. So every time Macy takes a swallow of milk, a little bit of that fluid goes not just down into her stomach, but goes into her trachea as well. So we are at risk for pneumonia and other breathing complications with that as well. So that is why Macy needs the G-tube at this time.
Okay. And how rare is it for a baby to be diagnosed with these conditions?
What Macy has occurs about 1 in 1,000 of times in the general population.
So Macy had surgery 3 days old. She's now 7 weeks old.
Yeah.
So talk about what happened after surgery and what were the next steps for you as a family?
So basically, after surgery, the biggest goals were getting her to breathe comfortably on her own without a lot of oxygen support. She's still working on that. And then she needed to be steadily gaining weight and tolerating feeds through what is now going to be her G-tube. We're not using her G-tube yet. They're using an NJ tube, which goes into her small intestines. That's how she's getting fed now. But it's been 6 weeks of trying to figure out exactly what Macy needs to basically thrive.
Are you pumping breast milk?
I'm pumping breast milk, and that's what she's getting through her NJ tube right now.
Have you had interaction with our lactation team for any support?
Absolutely. They've been phenomenal. We've tried some fancy things with my pumping just to increase the calories of the milk. They've been so great. I've learned so much more about breast milk than I ever knew existed, which has been fun. They've been great.
And so, where are we today with Macy? What is she working on right now?
She's still working on a couple things. The biggest thing is she's got a couple complications that are common in this repair, and one of them is something called tracheomalacia, which is basically an occlusion of her trachea, or her breathing, her windpipe, right at the repair site. And so because of that, she's still requiring a flow of oxygen basically to keep her airway open at all times. The thing that she needs for that to improve is growth. And so what we keep hearing from everyone is Macy has to grow, Macy has to grow.
Yeah.
So that's number one. So her breathing can improve. The other complication that's common with this is reflux. She also has that. And so that's another thing that we're trying to figure out what she needs. She's on reflux medication, which helps, but we're still noticing that she's struggling with that a little bit. And again, we were told growth is what she needs for that to improve.
Great.
So
I would like to introduce another member of our team here, Dr. Kirkpatrick. He's a pediatric cardiologist, and he's the director of our pulmonary hypertension program. Dr. Kirkpatrick, thank you so much for joining us. We've learned a lot about Macy over the last few minutes, and one of the things I've learned in kind of doing some research on the story is Macy's pulmonary hypertension. And I was wondering if you could first maybe introduce us to you, tell us about your role in the Herma Heart Center, and then tell us what do we mean by pulmonary hypertension.
Sure, absolutely. Well, like you said, I am one of the pediatric cardiologists here at the Herma Heart Center, and I am the director of the pediatric pulmonary hypertension program. And so what that is, when we have patients who are concerned about having pulmonary hypertension, and what that is an abnormal elevation of the blood pressure inside the lung blood vessels, which is a unique condition that's fairly rare. And we have developed a specialized program here at this hospital to address that particular disease entity.
So Macy has this?
So,
and
yeah.
how did she get it?
Yes. So, as part of Macy's workup, because of her tracheoesophageal fistula, all children who have that condition undergo an echocardiogram, which is a heart ultrasound. And the purpose of that is to see if there's any other associated heart abnormality, which can be commonly found up to about 75% of children with the condition that Macy has. Most of them you usually see are holes in the heart.
Okay.
As a part of that evaluation, they saw that the pressures inside the heart were abnormally elevated. And that what it means is that the heart's job is to push blood into the lungs. So if the lung pressures are high, the heart pressure has to be high too. And we can tell that by how we look at the heart through the ultrasound and how we measure speed of blood inside the heart. And we watched Macy with this, and seeing that she was still struggling with the increased work of breathing and trying to gain weight, we became concerned about it. And so my team got involved, and we began therapies to help address that very issue.
How is this treated then? How's Macy being treated for it then?
Yeah. Well, mainly when we see someone with pulmonary hypertension, we try to find out what are the key causes. And in Macy's case, she definitely had a airway abnormality where the esophagus and the trachea were connected. And that can set up some lung damage. In addition, she has some airway collapse as well. That can also make it difficult for her to constantly get air in and out of the lungs. We also see this in some children with genetic type syndromes as well. They can just be predisposed to that. So Macy has a number of risk factors that could set her up for this condition. So when we see that, our big thing is to see how we can improve her airway, her breathing. So her surgeries were very important for that. That prevents ongoing damage, and that was very successful with that. And the other thing is what we did in Macy's case was we started a special medicine called sildenafil. And what sildenafil does is it actually opens up blood vessels inside the lungs. It's called a pulmonary vasodilator. And with starting that medication, within 2 weeks after we started the medication, we noticed a marked improvement in the pressures inside her heart and lungs after that medication. So, yeah.
Just hearing you describe the level of care we provide babies like Macy is so extremely impressive. I wonder, Molly and Adam, what has the experience been like for you guys when you watch our doctors, nurses, and staff interact with you? I would imagine it can be, like I said earlier, almost overwhelming, but it all comes together, right?
It does.
It's overwhelming, but like we said, within the first 3-4 days of the surgery, the surgery team was in here every day and they looked at everything. So by the time that she was ready to go down for surgery, although there's the discomfort of knowing that your daughter's going down for surgery, but there's the comfort of seeing how much work went into everything and how many different things they looked at, or we're going to look at this because of this and because of this, and the planning that went on, it was really reassuring.
Yeah. And they communicate with families so well. Like I said, the surgery team rounds every single morning, and then they talk amongst each other, and then they talk to you in layman's terms exactly what's going on with your daughter and what they're going to do. And then the NICU team does the same thing. They will round every day. And then if you still have questions, the phenomenal nurses will sit down with you and say, okay, did you understand everything that the doctor said? So we've always felt so comfortable that she's in absolutely the best care.
We both received phone calls on our cell phones if we stepped out to grab dinner or something like that, and something comes up, they'll give you a phone call, and it's not like 3 people down the line, it's the doctor or the nurse that we need to talk to that's giving you a call.
Yeah.
So
they've really eased that.
Yeah.
Yeah.
Well, I'd like to introduce everybody to one of those amazing nurses. Her name is Emily Coogan, and she is one of the primary nurses who cares for Macy. So, Emily, maybe to begin with, can you describe your role as a nurse here in our NICU?
Sure. So my role as a nurse taking care of baby Macy is as a primary nurse. At Children's Hospital of Wisconsin, we really like to focus on the best care for kids, and how we've come to really develop the best care is to form a primary team of nurses. So that means that the same nurses taking care of the same babies as much as we possibly can. So I've gotten to follow Macy. I've known her since the day after she had her first surgery. And so I get to help navigate the family through the waters of medical terms and all the different specialties that are involved in her care, and coordinate with, Macy also has our physical therapy and our occupational therapy teams, our lactation, speech therapists. So I get to do a lot of coordination of care, and really work with the families on arranging for timing of things, so that it fits your schedule and your needs, but also to really focus on what Macy's needs are for the day too.
It's really amazing. I would imagine you get to know the families and the babies really well. Is that right?
We definitely get to spend a lot of time together. But like I said, primary nursing really helps the families be at ease so that they feel like when they do go away for dinner, like they were saying, that they'll get a phone call if there's something going on with their baby. But also so that, like in Adam and Molly's case, that they can go home for a day and know that their baby is really getting the best care possible, because they know exactly who the nurses are that are taking care of them because they see us every day. So it's really special to form that connection and help them navigate the waters down here.
And so while you're here, it sounds like you guys are staying at the Ronald McDonald House. Is that right?
That's right.
How's that experience been?
Well, other than you stay more than I do, I guess.
Yeah, it's been wonderful. They provide hot meals 5 to 6 times a week. They also have volunteer groups that come in and make brown bag lunches. So basically, you can wake up in the morning, grab a bag, bring it over to the hospital, and spend the whole day. And it's clean. The volunteers are phenomenal. So that's been really, really helpful because home is Appleton. It's a couple hours away. And it's great for kids. When our 2-year-old's down here, they have a swing set, they've got toys. They do their best to make it home away from home. And we're going on 2 months here, and it's been...
Well, and along those lines, I've been going back and forth much more. I'm usually down here 3 or 4 times a week, but in the meantime, we wanted to plan it so that our 2-year-old Paige would have, nights that she sleeps in her own bed and everything like that. And to know that Molly's staying at that facility, and I mean, it's a secure facility. It's connected to the hospital. Like she talked about the cleanliness. It's just something that we didn't have to worry about. Where it's there, everything's taken care of. If you have a question, they have answers to it, and they also provide a lot of other things. We celebrated our daughter Paige's birthday down here and brought everyone down, and they were able to help coordinate with. We went to the Milwaukee Zoo and things like that.
And they got free zoo passes.
Yeah.
So it's really great.
I'm curious, we probably have a lot of families who are tuning in right now who might be curious to know what advice you would have for a family who may be anticipating a NICU stay or might be on the beginning stage of a NICU stay. Do you have advice for others out there?
I think with us being away from home, staying at the Ronald McDonald House has been a godsend. And I think that rest assured, if you are away from home, I know that we met a family from Appleton that had to be here for 3 weeks, and they didn't use the Ronald McDonald House, and I think that was very difficult driving back and forth. So use the resources available to you. It's been great. If not, if you do live close, but you feel like you need to be with your baby, you actually can stay right in the NICU. These couches actually pull out, so you can sleep here as well. So this place is phenomenal. It's set up so your life can be as easy as possible, despite the circumstances.
When you look down at your beautiful daughter, what do you want for her? When you look forward in her life, what wishes do you have for her?
Oh, I want her to run and jump and play with her older sister, and hopefully her older sister needed a sibling because she was, everything was mine. So I can't wait till she starts stealing her older sister's toys and yeah. So that's what we're looking forward to when we come home, and yeah.
That's great. Well, all of us wish the best for your family, Molly, Adam. Thank you so much for sharing your story. It's been wonderful to meet Macy and learn more about her NICU journey. She's just beautiful.
She's waking up for everybody. Say hi.
And for everybody who would like to learn more about Children's Hospital of Wisconsin or our neonatal intensive care unit, you can visit our website at chw.org. Thanks again. I really
Thank
appreciate it.
you.
Bye.